Today, we're speaking with Dr. Michael Reynolds, a board-certified psychiatrist, to help us understand depression better. Dr. Reynolds, many people confuse regular sadness with clinical depression. How would you explain the difference?
Clinical depression is much more than temporary sadness. It's a serious medical condition where patients experience persistent low mood nearly every day for at least 2 weeks, combined with loss of interest in activities they used to enjoy. They'll typically have changes in sleep patterns, appetite, energy levels, and concentration. What makes it different from normal sadness is that these symptoms significantly impair daily functioning and don't just go away with time or positive thinking.
There's this common belief that depressed people just need to toughen up. What does the science say about that?
That's one of the most harmful misconceptions. Brain imaging studies show actual physical differences in the brains of depressed individuals, particularly in areas regulating mood and stress response. Telling someone with depression to snap out of it is like telling someone with diabetes to just produce more insulin. It's not only unhelpful, it shows a fundamental misunderstanding of the condition.
What about those online depression tests? Are they reliable?
While screening tools can raise awareness, they're no substitute for professional evaluation. A proper diagnosis requires a comprehensive assessment by a mental health professional who can rule out other medical conditions and evaluate the full clinical picture. That said, if someone scores high on a reputable screening tool, it's certainly worth following up with a doctor.
For someone diagnosed with depression, what treatment options actually work?
We have several evidence-based approaches. Medications like SSRIs help correct chemical imbalances in the brain. Psychotherapy, particularly cognitive behavioral therapy, teaches patients to identify and change negative thought patterns. For treatment-resistant cases, we might consider advanced options like TMS therapy. Lifestyle changes, including regular exercise and proper sleep hygiene, also play an important supporting role.
What's your advice for people who want to support a loved one with depression?
First, educate yourself about depression. Understanding it's an illness removes judgment. Offer consistent support without pressure. Simple statements like, "I'm here for you," mean more than advice. Gently encourage professional help, just as you would for any medical condition. Most importantly, be patient. Recovery takes time, and your steady presence makes a real difference.
Any final thoughts you'd like to share with our audience?
If you're struggling, please know, depression is not a personal failure. It's a treatable medical condition. Seeking help isn't weakness. It's the first brave step toward feeling better. And if you know someone affected, your understanding and support can be life-changing.
Thank you, Dr. Reynolds, for these important insights. For our viewers, if this discussion raised any concerns, please reach out to a mental health professional in your area. Remember, you're not alone.